My name is Daoud Dajani. I am a urologist with Chesapeake Urology. I practice out of our Largo location. I direct the genitourinary oncology program at the University of Maryland Capital Region Medical Center in Largo. I am originally from Jordan. I grew up there, so I did my medical school in Jordan. And then I came to the United States and I did a research fellowship at the University of Louisville, Kentucky. And then I actually started out training thinking I was going to become a general surgeon. So I did almost 2 years in Portland, Oregon Health and Science University. And during that time, I rotated on a urology service. And I thought that's where my passion is. So I actually was able to transfer. And I moved to Georgetown University here in Washington, D.C., did my residency, and then I did my fellowship in Los Angeles at the University of Southern California. My patient care philosophy, I always try to put myself in the shoes of the patient. I mean, I became a physician because my father, and I remember going to the doctor's office with him and him having surgery, and I remember it was a very difficult time in our family. So I always like to, put myself in the shoes of the patient. I try to individualize my care to each patient, so each patient is different. I try to answer their questions to the best of my ability. I try not to rush. I try to help them from the moment that they get their diagnosis or even before until hopefully we get to the cure and follow-up after that. I think that minimally invasive surgery and robotic surgery is kind of the wave of the future. I just chose to focus on that specific part because I felt like that's one of the best ways to help our patients. Minimally invasive surgery has the advantage of smaller incisions, quicker recovery, and actually I do believe it is more precise, especially in pelvic surgery. I think that field is going to continue to evolve, and I just felt that I could help more patients that way. One story that sticks to mind is I had a younger patient who has lost a brother and a father to prostate cancer. So he started his screening journey early. So he was about 40 years old and got the screening PSA test, and that was high, so it prompted us to do an MRI followed by a biopsy. And sure enough, he did have prostate cancer himself, underwent robotic surgery. And then I had the pleasure of following him for a few years after that, and he was married, had kids, and we'd always share that story. So it definitely felt great to see this success story, and as far as I know so far is no evidence of disease recurrence. Prince George's County, there are a lot of African American men in that county, and I felt that one of the reasons that I decided to take this job is that I felt like they didn't have access to excellent care. I still see a lot of patients who are younger or who haven't been screened, and then they present with metastatic disease, and I feel like those people, if they were screened earlier, we could have helped them earlier. People have the notion that prostate surgery means I'm going to be incontinent, I'm going to be impotent, and that's not necessarily the case. The technology has advanced a lot, and there's a lot that we can do to help those patients.